The Federal Ministry of Health has expressed worry over the high rate of female genital mutilation in the country, saying that over 2 million women and girls are at risk of this year. The Director of Ministry's Family Health Department, Dr. Salma Anas, made this known in Abuja, revealing that the recent partnership with the United Nations, which is being implemented in 5 states, has saved over 3,700 girls. Anas assured that the ministry will continue to create awareness on the negative effects of female genital mutilation in an effort to save the lives and dignity of women and girls.
Female genital mutilation still remains a problem in Nigeria. Globally, there are over 200 million people that are affected and living with it today, women and girls. And out of this, we still have over 2 million that are at risk of female genital mutilation in Nigeria. So we continue to partner since the launch of the partnership on women, girls, adolescents, and the elderly by the Honorable Minister of Health 2 years ago. We continue to leverage partnership across the country. Part of the partnership we had recently is on the joint program on elimination of female genital mutilation with the United Nations. And this was implemented in 5 states that have the highest burden of female genital mutilation in Nigeria. These states are Ebonyi, Imo, Oyo, Ekiti, and Osun State. And it was aimed at awareness creation on the hazards of FGM in Nigeria, and also ways to reduce the practices and ensure inclusion of FGM indicators into the National Health Management Information Systems. Achievements were made, and part of the major achievements made were targeted at young girls. Over 3,700 girls were saved from female genital mutilation as a result of the awareness campaign that took place in 5 of these states. And we have also been able to train over 730,000 men and religious leaders, including traditional leaders, on the negative impact of female genital mutilations. The boys are also not left behind. Over 800 boys were also sensitized and trained so that they can work together as partners to protect their sisters from such criminal practices that happens in our respective communities. So the project will also be scaled up to other parts of Nigeria, especially in the northern part, and Jigawa and Kaduna State have also been identified to scale up the project, where awareness will continue to be created until we are able to totally eliminate female genital mutilation. So we call on all Nigerians to be aware that this is silently happening in communities. And we all have a responsibility to protect women, especially the girls that are victims, because it has its own complications, negative implications on the health of girls, not only physical, but also psychological trauma. Moving now to another aspect where progress was made was on family planning. Nigeria remains committed to the provision of quality access to family planning commodities and services to women of reproductive age group, adolescents and girls, including men, to ensure that we have the right number of sites for our families. We also have healthy living. So part of what was launched by the Honorable Minister was the FP 2030 commitment. This is a global commitment of which Nigeria is part of that global commitment, and we have signed to it. And since the signing of the Global 2020, it started in 2020, it started in 2012, which was called that time FP 2020, and now it is 2030. So the Honorable Minister, in collaboration with the commissioners from all the 36 states of the Federation and all our relevant partners, including the civil society organizations, developed a national commitment that is all-encompassing, adopting the bottom-up approach. So this was signed and agreed upon. And by signing this, it means that the Nigerian government, not only at the federal, but also state government, civil society organizations, including traditional institutions, have committed to ensure access to affordable and quality services for women and children. So this was signed, and we are now working on a strategy for implementation. And we have adopted what we call the balanced scorecard approach to develop that strategy. And we have already started engaging with all the key partners to ensure that it is rolled out at all levels, especially at community level.